three important discoveries that reduce the mortality or death in children are use of antibiotic against infections, number 2, immunization or vaccination against diseases, and number 3, use of ORS or ORT therapy in diarrheal disorders. Today we are discussing about immunization in infants. Infant means children in the age group of 0 to 1 year. All of us know that three important discoveries that reduce the mortality or death in children are use of antibiotic against infections, number 2, immunization or vaccination against diseases, and number 3, use of ORS or ORT therapy in diarrheal disorders. Today we are discussing about immunizations in children less than 1 year of age. At birth, each and every child should get three important vaccines. What are they? Number 1, BCG. BCG is a vaccine that we usually give to prevent tuberculosis in children. The dangerous forms of tuberculosis are prevented by giving BCG vaccine. We are giving this BCG vaccine in the left upper arm at the insertion of the muscle known as deltoid. It is given intradermally and it forms a papule after 3 weeks and then it crusts and it is going to be very effective. The next vaccine that we give immediately after birth is vaccine against hepatitis B. As you know, hepatitis B is a chronic disease that spread from people to people through blood and blood products and through injections that we are taking for one or other purpose. That we can prevent by giving this vaccine at birth and then again we give after some time also, that I will tell you later. And another important vaccine that we give is oral polio vaccination. In India, right now, there are no polio cases from 2013, but in our neighboring countries have polio. At any time, a case may come from those countries. So, till the whole world eradicates polio, we have to give polio vaccine. The next vaccine that we give is at the age of 6 weeks. That means after 42nd day. So, what are those vaccinations? Vaccine against pneumonia, vaccine against diphtheria, vaccine against tetanus, and vaccine against a condition known as whooping cough. So, all these vaccines are combined together and known as Pentavac. So, this is an injection and that is given intramuscularly. Along with that, we give oral polio vaccination first dose and then we give injectable polio vaccination to ensure complete immunity. And then one more important vaccination that we give at the age of 6 weeks is known as rotavirus vaccination. This rotavirus vaccine is very helpful to prevent diarrheal disorders in children. The same vaccine we will repeat at 14 weeks of age. At 10th week of age, we are giving Pentavac, OPV2 and rotavirus 2. Now, the government of India has introduced another important vaccination to all children in this country that is given at the age of 6 weeks, 14 weeks and at 9 months. The name of the vaccination is vaccine against pneumococcal disease. Pneumococcal infections are an important cause for pneumonia and meningitis in young children. We can prevent this by giving vaccine against pneumococci at 6 weeks, 14 weeks and 9 months. Now, after 6, 10 and 14 weeks, we will give another important vaccination at the age of 9 months. What is that vaccination? That vaccine is known as MR vaccine. MR vaccine contains vaccine against measles and rubella. As you know, rubella is a dangerous disease for women. If the mother contracts rubella during pregnancy, baby can develop a condition known as rubella syndrome. So that's a very serious condition for infants and that can produce devastating changes for the infant. So that we can prevent by giving this MR vaccination. Along with the MR vaccine, we will give vitamin A also. So vitamin A is very important to prevent eye problem, especially corneal problem. So this is the recommendation given by the National Immunization Schedule or Government of India. But you know, there is another Academy of Pediatrics is there, that is known as Indian Academy of Pediatrics. So they advise some more vaccinations to children less than 1 year of age. What are they? That those vaccines are vaccine against influenza. We know that at the end of summer or the beginning of the monsoon, children used to have infection, viral fever. Actually, most of these cases of viral fever are due to influenza. You can prevent influenza by giving vaccine against influenza from 6 months of age onwards. Initially, in children, we are giving 2 doses of influenza vaccine at 1 month difference. Okay, then the Indian Academy of Pediatrics recommends another important vaccine at the age of 6 months, that is vaccine against typhoid. So this vaccine has to be given only once in lifetime. Okay, in Indian Academy of Pediatrics recommends one more vaccination at the age of 9 months instead of MR. They are suggesting MMR. So what is the difference between MR and MMR? So MMR contains mumps in addition. So MR contains only measles and rubella, while MMR contains measles, mumps and rubella. It's very important to prevent mumps also, as mumps can affect each and every system. For example, if it affects a testicle in a male child, that can lead to sterility at a later time. So it is very important that our children should get MMR at the age of 9 months. So we will give some more doses after the age of 9 months. So these are the vaccines that we usually give to children less than 1 year. By giving this vaccine, we can prevent almost all dreaded disease that affects children less than 1 year. I will repeat: measles, mumps, rubella, diphtheria, tetanus, whooping cough or pertussis, and then pneumonia due to H influenza type B, and pneumonia due to pneumococci, and also diarrhea due to rotavirus and polio. By giving these vaccines, so we are allowing our children to grow like anything. They will become a useful citizen of our country. So it's very important that all of us should take this vaccination all of us should give vaccination to our children. So these vaccines are absolutely safe. The side effects are very, very less. At the maximum, they can have a fever that also we can manage by giving acetaminophen, otherwise known as paracetamol, at a dose of 15 milligram per kilogram body weight after 4 hours of vaccination. You can repeat the same dose after 4 hours if needed. It is better that you should not give this paracetamol unnecessarily to children who has taken vaccine. But if they have fever or if they have high pain, you can give the vaccine. So these are the things that I want to tell you about the vaccination in children less than 1 year. Thank you so much for the patient hearing.